Have you ever felt that your mind is different? I'm not talking about occasionally forgetting where you left your glasses. I mean that strange feeling that your thoughts are slower, that your patience has diminished, that simple everyday decisions have become difficult, and above all, that silent anguish of realizing something is changing inside you, but not being able to explain what. Because I need to tell you a truth many avoid facing. Your mind may be crying out for help. And if you don't learn to recognize these signs now, you could be heading toward a decline that is still possible to prevent. What most people call just getting older may actually be the first warning of serious illnesses affecting millions of older adults in silence. And worst of all, these signals are almost always ignored by their own families. Over the years, caring for those who seek to age with dignity and health, I've identified 7 clear, recurring, and dangerous signs that indicate the mind is suffering. Today, I want to reveal each one to you, with real examples, practical guidance, and a serious warning. If you notice any of these signs in yourself or someone close to you, don't wait. The time to act is now. We're talking about lucidity, emotional health, disease prevention, and true well-being. But before diving into these insights, I have a request. Subscribe to the channel right now. This isn't just a gesture of support, it's the way to ensure you receive content like this. Content that can literally prolong your life with more autonomy and mental clarity. Here you'll find reliable information on health in later life, strategies for healthy aging, and practical advice from a doctor devoted to studying the older brain. In this video, you'll learn to identify the first signs that something isn't right. Dangerous forgetfulness, sudden mood swings, difficulty expressing yourself, constant mental fog, and even the loss of pleasure in life. And most importantly, I'll show you how to react, what to do, and which habits to adopt to strengthen your mind before it collapses. This is not exaggeration, it's urgency. Those who understand this now will have a huge advantage in the years to come. While many continue to lose their lucidity in silence, you will be learning how to protect your most valuable asset, your mind. So get ready, because the signs have already begun, and you need to see them before it's too late. 1. Frequent forgetfulness that disrupts your routine. Have you ever walked into a room and, for a brief moment, completely forgotten why you went in? Or maybe you put your keys in the fridge and the remote control in the kitchen cabinet? These little lapses, when they become frequent, are more than harmless distractions. They can be the brain's first whispers, crying out for attention, begging for help. The mind, overloaded by risk factors like chronic stress, lack of cognitive stimulation, and poor sleep quality, begins to show signs of fatigue, and this must be taken seriously. Health in later life doesn't depend solely on a strong heart or sturdy bones. It lives, above all, in the head. When an older adult starts forgetting appointments, the names of close friends, or even simple tasks like turning off the stove after cooking, it directly impacts their well-being and autonomy. And here lies the silent danger. Many think it's part of natural aging, but the truth is that memory needs daily exercise, just like muscles do. Neglecting the mind can accelerate degenerative processes, undermining both quality of life and longevity. It's essential to understand that the brain does age, but it doesn't necessarily fall ill. Science has shown that activities like reading, crossword puzzles, deep conversations, or even learning new skills, playing an instrument or crocheting, help preserve memory and prevent neurological diseases. As neurologist Dr. Daniel Levitin said, the older brain can continue to grow and form connections if properly stimulated. This means that even at 75, it's possible to reprogram your habits to strengthen mental resilience. The secret lies in consistency and observation. Forgetting a neighbor's name one day is normal, but repeating it 3 times a week, that's a red flag. Forgetting where you left your glasses but then remembering later is fine, but when not even fridge reminders help, the mind is trying to tell you something. The good news is it's never too late to listen, and paying attention may be the first step toward healthy aging, with more clarity, joy, and dignity. 2. Difficulty. Making simple decisions. Have you ever found choosing between coffee or tea in the morning feels like solving a math problem, or deciding what to wear for a walk turns into a minutes-long dilemma? Believe me, this isn't just indecision. It's a subtle but serious sign that the mind may be losing its agility. When everyday choices start interrupting your routine, something in the brain is crying out for help, and it needs to be heard. In clinical practice, it's common to hear from patients who were always organized but now find themselves unable to make a shopping list or plan a family lunch. These small-seeming situations reveal a lot about mental health. The brain, especially after 70, has more difficulty filtering stimuli and organizing information. This compromises decision-making, a process that relies on multiple brain areas working in sync. Losing this ability directly affects well-being and autonomy. There's an important concept few know: mental fatigue. Yes, the mind gets tired too, and that exhaustion can be silent. It arises when the brain is constantly taxed, but not fueled with healthy lifestyle habits. Omega-3-rich nutrition, quality sleep, physical exercise, and social interaction are essential fuels for optimal cognitive function. A Harvard University study showed that regular walking can boost frontal lobe efficiency by up to 40%, the region responsible for logical reasoning and decision-making. So, if you notice simple tasks becoming obstacles, it's time to re-evaluate. It's not fear or laziness, it's the mind screaming for rescue, and that rescue begins with awareness and care. Small actions, establishing clear routines, writing daily goals, or talking to someone you trust, can be keys to regaining mental control. Remember, keeping the brain sharp is as important as keeping the body active, and as we'll see next, when the mind falters, mood and personality also feel that subtle but profound impact. 3. Sudden mood or personality changes. Imagine someone who's always been kind, patient, and good-humored. Suddenly they respond harshly, isolate themselves in silence, or begin to distrust even close family members. Changes like these don't happen by chance. Most of the time they signal that the mind is out of balance, and what's alarming is that this can set in slowly, almost unnoticed, until it becomes part of daily life. In that moment, the brain is simply shouting with all its might that it needs help, care, and attention. Mood changes in later life shouldn't be dismissed as a normal part of aging. Science has proven that the older brain can still produce serotonin, dopamine, and other feel-good neurotransmitters, but it needs the right stimuli. When these levels drop abruptly, unusual behaviors, persistent discouragement, or emotional outbursts can emerge. These are risk factors that, if ignored, can open the door to more serious conditions like depression, dementia, or mood disorders. This is where disease prevention through active listening and emotional support becomes crucial. For caregivers, it's essential to distinguish between a rough patch and a persistent symptom. When emotional fluctuations stop being exceptions and become the new norm, it's time to investigate. Simple tests, medication adjustments, or lifestyle changes can restore balance. In many cases, B-complex vitamin supplements or increased exposure to sunlight bring noticeable improvements. As neurologist Dr. Paolo Bertolucci states, behavior is the mirror of the brain. If it changes, it's because something inside has changed. And that demands action. 4. Loss of interest in previously enjoyed activities. When someone starts to abandon what once brought them joy, whether it's gardening, outdoor walks, meeting friends, or even their favorite meal, it's a sign something inside is slowly fading. It's not just fatigue or laziness. It's as if the life spark is dimming, leaving the body present but the soul absent, and this is one of the most subtle and dangerous signs that the mind is pleading for help. What's at risk is the very desire to live. This loss of interest can be the onset of mild depression, common in later life but often overlooked. Older adults who lose enthusiasm for everyday pleasures are more prone to chronic illnesses, accelerated cognitive decline, and even reduced longevity. The absence of joy directly impacts the immune system, hormone production, and brain function. Well-being is built daily, and the pleasure of living is a cornerstone of health in later years. One of the biggest mistakes I see as a physician is treating this apathy as normal for their age. It's not. A life without purpose doesn't strengthen resilience, it weakens it. The good news is that reconnecting with life's pleasures is possible. Sometimes all it takes is a new habit. Senior dance classes, group walks, or craft workshops. These activities not only reactivate dormant brain areas, but also promote social interaction, another key factor in preventing mental health issues. A University of Oxford study found that older adults who maintain enjoyable activities have 32% lower risk of developing dementia. This shows that joy isn't a luxury, it's therapy. The mind needs stimulation, surprise, and connection. When the soul stops smiling, the body feels it, but rediscovering pleasure is possible. And in the next section, we'll explore a direct consequence of this disconnection, difficulty communicating, which can surface even in the simplest conversations. 5. Difficulty expressing yourself or forgetting. Simple words. Have you noticed when someone freezes mid-sentence, searching for that everyday word that just won't come? Sometimes it's the name of a common object, other times a familiar term. When this type of lapse becomes frequent, it's a clear sign the mind is begging for attention. It's not a simple, blank moment. It's a breakdown in the connection between thought and speech, a phenomenon tied to brain aging and little-known risk factors. Difficulty expressing oneself can emerge gradually, first swapping simple words for similar ones, then avoiding longer conversations out of fear of mistakes, until in some cases, communication itself becomes an effort. This disconnect between mind and language deeply affects an older adult's well-being. Language is more than words. It's identity, autonomy, dignity. Losing the ability to name the world means losing a piece of freedom. It's important to know the brain can regenerate and relearn. The secret lies in lifestyle habits, activities like singing, reading aloud, teaching something to someone, or narrating your day to a grandchild are strategies that keep vocabulary active. In my clinical practice, I've seen older adults regain fluency with daily oral narration exercises and reading psalms. Speech, when practiced with affection, becomes a powerful remedy. And this isn't an exaggeration. Language activates brain regions that also regulate emotion and memory. Moreover, many ignore that nutrition directly impacts verbal fluency. Regular consumption of choline-rich foods, eggs, broccoli, liver, supports acetylcholine production, a neurotransmitter essential for memory and language. In other words, a simple morning vitamin can be an ally of communication. When we talk about longevity, we also talk about keeping the ability to express ourselves clearly and confidently alive. And this clarity becomes even more vital when considering the next sign, perhaps one of the most dangerous, disorientation in familiar places. 6. Disorientation in familiar places. Imagine waking up one morning, walking through your own home, and suddenly not remembering where the bathroom is. Or going to your neighborhood bakery, the same one you visited for years, and feeling you don't know how to get back. This disorientation isn't mere momentary confusion, it's an alarm. When the brain fails at spatial memory in familiar environments, it means something deeper is at play. In that moment, the mind isn't distracted. It's signaling an overload that demands urgent attention. Many older adults describe such episodes as a strange sensation, like being in a known place with a foreign mind. This phenomenon is called spatial memory dysfunction. It's linked to the hippocampus, the brain region responsible for orienting us in space, and one of the first to be affected by accelerated brain aging. Health in later life must include the ability to move with autonomy and confidence. Without it, you lose not just your route, but your self-assurance. What few know is that simple strategies can combat this loss of orientation. Mental maps, for instance, are powerful exercises. Drawing the route to the pharmacy, memorizing furniture placement at home, or intentionally moving small objects and later trying to recall their new positions. These practices reinforce neural connections and slow cognitive decline. Additionally, daily mindful walks, paying attention to landmarks, stimulate the brain to stay active and alert. Remember, anyone can get momentarily disoriented. But when it becomes recurrent, especially in familiar settings, it's time for a medical evaluation. Preventing diseases like Alzheimer's and vascular dementia begins with identifying these early signs. The older adult needs to feel secure in their environment, and family members must stay vigilant, because sometimes what seems like a silly lapse is actually the brain's red alert. 7. Constant feeling of confusion or mental fog. Have you ever experienced that sensation of your head being full and yet empty, as if your thoughts won't fit together, like scattered pieces of an impossible jigsaw puzzle? Many older adults describe this as a mental fog, and that's exactly the metaphor medicine uses to talk about a clouded mind. This constant confusion, which makes even simple tasks feel challenging, is another silent sign the brain is exhausted. And the scariest part, it's trying to warn you before it's too late. When this kind of fog sets in daily life, even basic activities, sorting the month's bills or making coffee, can become a struggle. The mind fails to process information, and instead of clarity, you get fatigue, irritability, and even fear. This symptom is particularly dangerous because in most cases it's not recognized as a clinical warning. Many assume it's normal for their age, when in fact it may be the start of a degenerative process that jeopardizes longevity and well-being. The good news is there are ways to clear that fog. Studies show that habits like guided meditation, mindful breathing, and adequate magnesium intake have direct effects on mental clarity. Foods such as avocado, nuts, and spinach, rich in healthy fats and antioxidants, are natural brain remedies. And never underestimate hydration. A dehydrated mind works slowly. That's why, as a geriatric physician, I always insist: drink water as if it were an elixir of lucidity. Having a healthy mind after 70 takes more than luck. It requires presence, vigilance, and conscious choices. It's not about avoiding aging, but living it with intelligence and dignity. When the mind cries out for help, it doesn't want silence, it wants action, and action begins with understanding. By recognizing these signs, we are truly listening to our brain's heartbeat. And by caring for it, we write a new story for health in later life, with more autonomy, clarity, and joy in living. And now tell me, which of these signs worries you the most? Have you noticed any of these changes in yourself or a family member? Leave a comment below. Your experience could help others going through the same. If you found this content helpful, subscribe to the channel now and hit the notification bell. That way, you won't miss any upcoming videos packed with transformative insights on health, well-being, and longevity. Thank you for watching until the end. Take care of your mind, preserve your autonomy, and keep striving for the best in your life. See you in the next video.